How do you know if new filler is a bruising, swelling issue or problem with the product placement? Received Restylane under the eyes yesterday, and I know that sometimes swelling, bruising can occur. There is a triangle of swelling on one side and a large lump on the other side. These seem to be below my hollows, which have me worried since it was supposed to be for my hollows. Maybe it is swelling from injection site. Should I be worried or wait to worry if it is still there after 2 weeks? I have had fillers in the past and am always shocked by swelling, but never had hollows filled.
Thank you for your question. You submitted photos with a description of having undergone Restylane injection under your eye, and you're concerned about swelling and bruising and irregularities, and you had it done the day before you submitted the photos. Well, certainly I can assist you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. Rejuvenation of the eyes is a big part of my practice. I do a lot of injectable treatments, including the use of Restylane for the treatment of under-eye rejuvenation. So I can certainly give you some perspective as to the areas of concern that you have. To begin with, although you have submitted this question, I would strongly encourage you to speak directly to your doctor. Your doctor is the one who performed the treatment. Your doctor knows what went on during the treatment and should be able to answer these questions very clearly. Now, that being said, I can tell you that there are a few things that you should be aware of when you ask a question like this. Number one is, first question I would have is, how did you like the way it looked once it was done? Did you feel like it looked good? And the reason I say that is when you do any kind of filler, there is always a certain amount of swelling that occurs immediately. There's a certain amount of swelling that occurs a little bit later. In our practice, it is routine to see our patients 2 weeks after we do an injectable anywhere on the face because it allows that much time for things to settle down. The eyelid is a very vascular area. It's very easy to create a bruise. So I would say that certainly what you are showing in the photos can be certainly described as within the range of normal. But you're describing also an adjacent area which looks hollow. So just to give you an overview of the way I look at someone's face when they want to have under-eye rejuvenation, what I think of. The reality of eye aging is that it doesn't occur in isolation. When I look at someone's under-eye concerns, I also look at it in relation to the cheek. And by looking at the eyelid or eyelid to cheek junction and in the cheek itself, I describe for the patient the areas that also could probably benefit with volume in addition to the relative hollow under the eye. It is very common for me to see people who got an injectable placed directly under the eye and to feel like that there's like a worm or a swelling that doesn't look very good. So they come to me to actually dissolve the material, which is convenient because there's at least an enzyme that we use called hyaluronidase that's able to accomplish that. But I think a lot of times they don't realize that if they also restore volume in the cheek, that there could be a better continuity. We do a procedure where we do structural volumizing of the cheekbones that will blend very nicely with the under eye area. So it is my philosophy to try to create a volume correction that's more global and helps the person look more youthful rather than chasing hollows and lines. There's always a role for that, but that's just one thing to maybe ask yourself. Were you aware that the cheek looked relatively flat beforehand, or do you notice that now that there's volume correction and now there is contrast? Now, as far as the most important concern when you worry about something immediately after a procedure of excessive bleeding or infection, the photos you submitted do not appear to reflect anything like that. So, I think that with this situation, without interfering with what your doctor is advising you, I would say that you are probably dealing with something that is normal, maybe normal for you, and will probably get better on its own. But at the same time, your doctor may guide you to do some massage or to have you come in to reevaluate you. I think that one of the traps that people fall into, and I'm not saying this is specific to you, is that they shop fillers. They think that the filler under eye is like a generic procedure. I promise you, it is an art. And what I explain to my patients is developing a relationship with the doctor and having that doctor know you and know your anatomy in a way that is more familiar with continuous ongoing care is a lot more effective in the long run than people jumping from one doctor to another to get injectables. I see these patients all the time, and I always find out that they bounce from one place to another. And so I would just advise you that if you like this doctor and you are comfortable with this doctor, work this way through with your doctor to achieve the goals that you ultimately want to achieve. So in summary, I would say that just to review, there is some volume in there because of the actual filler, from reactive swelling, from the bruise, and just some irregularities from all those factors overlapping. So the question is whether it's normal or whether it is unusual. I think really relates to what you looked like before the procedure, what did you experience immediately after the procedure, and this ongoing relationship and communication with your doctor as to what to do moving forward. 24 hours is not a long time. So you probably may be overinterpreting, although it's certainly reasonable if you feel concerned about the way your eye appears. So I hope that was helpful. I wish you the best of luck. Thank you for your question.